Imagine being told that without a certain medicine, you'll die. Yet that same medicine is now out of your financial reach. This is not fiction. This is happening right now to millions of people. Today we unravel the shocking truth about insulin, a drug discovered over 100 years ago that was supposed to be affordable for all. But somehow it has become a profit engine for corporations while patients suffer, ration, and even die. Curious yet, what happened between a $1 patent and today's $300 price tag? Why are Americans dying while the rest of the world pays a fraction for the same drug? You'll want to stay with us, because this story affects you even if you don't have diabetes. The miracle discovery. In 1921, Canadian scientist Frederick Banting and his assistant Charles Best achieved what many believed impossible. They isolated insulin, a hormone that could manage type 1 diabetes, previously a death sentence. This discovery changed modern medicine forever. Banting and his team didn't want to profit from this miracle. In a revolutionary act of ethics, they sold the patent to the University of Toronto for just $1, insisting the discovery belonged to humanity, not the highest bidder. They believed no one should profit from life-saving medicine. Fast forward a century, and that noble belief has been trampled by corporate greed, legal manipulation, and a broken system. The tragedy is that Banting would be horrified to see what insulin has become today. How insulin turned into a business. Insulin's early development was collaborative, open, and focused on access. But in the 1980s and 1990s, pharmaceutical companies began creating synthetic versions, insulin analogs, with slight modifications that extended their patents and locked out competition. Enter the big three: Eli Lilly, Novo Nordisk, and Sanofi. These companies dominate 90% of the global insulin market, using their power to suppress generics and artificially inflate prices. In the US, the price of a vial tripled between 2002 and 2013, hitting $300 or more by the late 2000s. Most diabetics need multiple vials per month, meaning some spend over $1,000 monthly just to stay alive. The cruel irony: the drug itself costs manufacturers under $6 per vial to produce. The rest? Pure markup, middlemen, and market manipulation. This isn't a drug problem, it's a business model problem, and patients are paying with their lives. Who's suffering the most? Over 37 million Americans live with diabetes. For type 1 diabetics, insulin is not optional. Without it, the body shuts down in days. Yet access to it depends not on need, but on your wallet and insurance status. A heartbreaking one: in 4 diabetics in the US admit to rationing insulin due to high costs. This leads to deadly consequences like diabetic ketoacidosis, a painful and fast-moving condition that often ends in ICU visits or death. It's not just adults. Teens, young adults, and even children have died because they tried to stretch their insulin supply just a few more days. These aren't isolated cases. They are part of a devastating, ongoing national tragedy. In what kind of country is survival treated like a luxury item? If the system worked, no one would have to choose between living or affording groceries. The price game loophole. So why can't cheaper insulin flood the market? The answer lies in patent abuse, lobbying, and a complex pricing web that defies logic. Drug companies practice evergreening, making minuscule changes to insulin formulas to renew patents, preventing generic versions from entering the market. This has created a decades-long monopoly. Then there are the PBMs, pharmacy benefit managers. These middlemen negotiate drug prices between insurers, pharmacies, and manufacturers. In reality, they often drive prices up, pocketing huge rebates along the way. The result? Patients pay more, while corporations profit quietly in the background. Pharma companies also spend tens of millions of dollars annually on lobbying. That money goes into influencing lawmakers, blocking reform bills, and ensuring the system stays rigged in their favor. It's not just unethical, it's deadly. Global perspective. This is not a global problem. It's a uniquely American tragedy. In Canada, insulin costs around $35 per vial. In Germany, it's even lower. In India, insulin is considered a public essential and subsidized. In contrast, the United States pays 8 to 10 times more for the same medication. Why? Because in most countries, healthcare systems negotiate drug prices or cap them by law. The US does neither. Instead, it allows free market chaos where the sick must outbid one another for the right to live. The US holds just 15% of the world's diabetic population, but makes up nearly half of global insulin revenue. The math is horrifying. The burden is not shared, it is exploited. Even more shocking, some Americans travel to Mexico or Canada monthly just to buy insulin legally and affordably. This is a first world nation with third world insulin access. The push for change. But change is on the horizon. Activists, families, and diabetes organizations like T1 International and Number Insulin 4 all are putting massive pressure on policymakers. Their protests have gone viral, their stories have shaken legislators, and the tide is turning. In 2022, a major win came when insulin copays were capped at $35 a month for Medicare recipients. But that still leaves millions of uninsured and underinsured people in the dust. It's a start, not a solution. Meanwhile, nonprofit disruptors like Civica RX are promising generic insulin for under $30 per vial by 2025. If they deliver, it could finally break Big Pharma's grip. But entrenched power doesn't surrender easily. To win this fight, the public must stay loud, stay angry, and stay informed. The crisis didn't happen overnight, and change won't either. But it can happen. This story is bigger than insulin. It's a window into a healthcare system that's broken, corrupted, and in desperate need of reform. A drug created with compassion has become a commodity of exploitation. Families are being bankrupted, lives are being lost, and corporations keep posting record profits. This is not the cost of medicine, it's the cost of apathy and unchecked greed. So what now? Educate yourself, raise your voice, share this video, demand regulation, support organizations working for insulin justice. Because change doesn't begin in Congress, it begins with you. And always remember, life-saving medicine should never be a luxury item.